She's got tumors that are blocking her nose, they're obscuring her line of sight, and they're starting to actually intrude upon the way she eats. So we're gonna try to clear those areas up. What's going on?
I'm fine, I'm okay, anxious for today.
Yeah, you look beautiful. You got your hair braided and everything?
Not all, but yeah, halfway.
Almost.
Yeah, okay.
I didn't sleep very well, just a couple of hours. I just feel a little bit nervous about the surgery in general, but I trust Dr. Osborne. I can't imagine how it's going to be to move around without the tumor.
So this morning, Alexandra's here. Our goal today is going to be to take off this massive weight that's pulling her neck and back down and try not to lose too much blood in the process. She weighs about 80 pounds. This tumor is about 20% of her body weight, which is pretty significant. And we're going to be removing that in one day. It was very difficult to understand how she was supporting this much weight, but now I'm starting to see it. On the left side, it's running down to the upper back, but on the right side, it's really attached to the shoulder and the side of the neck and stopping around the upper back. So the broader attachment means that there's more tissue that's gonna have to be mobilized and more tissue have to go through. It also means the reconstructions, there's gonna be a much bigger defect here on her back. I don't know if that's gonna change my game plan or not. Really never were able to put her in this position during consultation. So this is a different look. Just gonna have to just see how this goes. The hairy moments are going to primarily be controlling blood flow. I saw on her MRI the main axis of the attachment has a very large blood vessel. And I'm just hoping that I'm able to control that without a ton of blood loss, and hopefully she can tolerate it and it doesn't throw off the rest of her system.
See if you can slide it under?
So I'm gonna try to see if we can elevate the bulk of this mass. In order to minimize her blood loss, we're going to raise the tumor above her heart. That will make it harder for the heart to pump blood into it. If you lose a significant amount of blood immediately, that becomes a shock to the body. And I don't know how much blood would be in there. We're gonna do this in 2 phases. Phase 1 will be to take probably from about here, and we'll take this off. And then we'll do phase 2, which will be modifying this last portion. We're gonna get rid of this cape first. Her superhero days are gonna be over soon. She's gonna have to be a different superhero, one that doesn't have a cape. Or drop the room lights. Not try your cell phone. Yeah, that'll work. If you use the right amount of light at the right distance, you can actually see the outline of blood vessels through the tissue. And then what I did was I marked out where I think those blood vessels are. There's a lot more than the one that I thought that I was gonna have to deal with. All right, so let's keep moving. So now I'm gonna sort of try to put a tight wrap around the lower part of the tumor, just to kind of squeeze some of the blood out. Okay, it's elevated, so gravity is pulling the blood down, so that's minimizing how much blood flow we'll hopefully have to deal with. I'm thinking, do we have any sterile bags?
We can use probably like a mayo stand cover as a bag.
Okay, you're getting creative. I like that. I like that. I want to have the option to flip this forward if I need to be able to see the undersurface. So we're going to try to wrap this in a quasi-sterile packet. We're going to kind of jimmy rig something here. There's no textbooks for this, that's for sure. It's so heavy. I'm using my elbow and bracing it up against my body so I'm not having to just rely on my arms. Gotta do those core workouts. The weight of this thing should hold it. first incision. So in the beginning of surgery, it's a dance. I'm just trying to get to know this tumor. I'm not trying to really take it down yet. I'm just trying to see what special equipment it's brought to the fight. Did it come with a knife or a gun? So we're moving along pretty well. I like what's going on so far. So I think I want to flip it. Just put your arms out like. I'm very happy with the amount of blood loss. I expected this to be a case where we would have a reasonable amount. It's manageable, especially for a tumor of this size. To the last vessel. I can't believe it. This little guy here is saying, it's not over till it's over. As long as I've got one blood vessel left, I'm still in the game. I got respect for it. Not enough not to do this to it, though. So that is amazing. All right, let's get this thing off of the table.
Yeah.
So we're moving into the next phase of this procedure, which is to resect the remainder of this tumor and try to give her a better looking neck than she's had over the last decade. This is half of the stock, so we've still got the right attachment. And so we're almost home free. Okay, that was a mother load. A lot of blood vessels, but we accomplished the goal. Now we start closure. Nice job for everybody.
Teamwork, baby.
So we're done, finally. Overall, the surgery went very well. We moved very methodically.
Can you look over here? Who's that? Who's that? Dr. Osborne. There you go.
It feels so much joy now. It's better than I ever imagined. I imagined how might it be without the tumor, and it's so much better than in my dreams. After the surgery, I woke up and I immediately feel better. It makes me so happy to be rid of the tumor. Before the surgery, I always had to ask somebody if they can help me. It's so much easier to dress myself now. And over my head, I just pull the pillow over my head and it's done. I'm dressed. I can wear a necklace now to not worry about the tumor. I don't hurt the skin. I'm so happy to have a normal neck.
Feel that there?
Have the cradle?
Yeah. How's that feel?
Oh, absolutely perfect. Howdy, partner.
Long time no see.
Here,
I loved it when they called you Mr. O.
Dr. O.
Today is Tim's surgery, and we will be performing a massive parotidectomy.
Start getting you off to sleep, okay? Yeah. See you when you're all done, okay? We'll all be with you the entire time to take care of you, okay? Sweet dreams, Tim.
Should we navigate removing this tumor without causing any permanent paralysis, one of Tim's primary concerns was, will he have a concavity after taking so much volume away? If we feel the need to fill in a defect, we are prepared to do it. The thing that's kind of interesting is you worry about a cosmetic concavity when you have well, literally a bowling ball-sized tumor kind of growing from the side of your face, it's really the last thing I would think he would have as a concern. Skin incision. We know we have to remove some of this skin with the tumor just because it's too attached, but a lot of the skin can be saved on what is presumably a benign tumor until proven otherwise. That beeping you hear there, that's the facial nerve monitor. Lets us know when we're getting near the facial nerve. So right now the monitor is saying I'm hitting a nerve, but it's saying that on almost everything, which can't be right. We use the facial nerve monitor to help us identify when we're either near a nerve or actually touching a nerve. But right now, the thing's going off with everything I touch, which means it just isn't working. So from here on out, I'm basically just flying blind, hoping that I don't hit anything major that would cause a facial paralysis. It's not very helpful today. So this is actually the nerve that's going up to the earlobe, and that has to be cut. We have to go through it. But he was aware of it. I told him that there's a 100% chance that I will be cutting that nerve. Okay. So there's nerve here, going right here. So what we're doing right now is we're trying to identify the nerve that moved the upper face. If we cut that nerve, that is instant facial paralysis. Yeah, that's a big boy. That's a good nerve. That's pretty big. I think that's probably the one doing most of the work. So it seems we found the facial nerve, and that is a huge relief. We're able to find his facial nerve, preserve it. That's good. We're making good progress. I guess we're saying goodbye to little Timmy. But we have one more hurdle to overcome. Right now, these little nerves have no support. So if Dr. Hamilton drops the tumor, it will rip this nerve right out of his head, and he'll be paralyzed even though we went through all this work. So this is actually the more dangerous part of the procedure, because until we fully separate it, we are now the only things supporting that nerve. Here we go. Bye-bye. This thing is heavy. It really is. Now it's like separating conjoined twins, you know? There is no possible way to say that there is no malignant cells within this tumor. It's too big.
5 pounds, 12 ounces.
It's gonna require the pathologist to really work through all the tissue. I know that while Tim wanted this tumor out, the part that he was most concerned about is what Dr. Hamilton's working on now, which is give Tim the most symmetrical reconstruction we can. All I can say, great job. Thank you, sir. I think Christmas came early for him. I feel good about his surgery. The nerves were not cut, and we were able to take the tumor out in one piece, which minimizes the chances of a recurrence. But I don't know if there's any facial paralysis. There's no possible way for me to know until he wakes up. Tim, it's Dr. Osborne. Do a few things for me, okay? Can you raise your eyebrows? Can you close your eyes? Can you pucker your lips? All good. Everything's moving.
I came out here to get my first real shave since surgery.
When the tumor was there, I would cut the hair, but I really didn't mess with it.
Alley-oop.
Oh my goodness. Here we go.
There you are, Tim.
Wow. Look at that. Man, do you have the baton? I'm gonna have to fight him off out there.
Yeah. Oh, yeah, absolutely.
Look at that. This is absolutely fantastic. A few months ago, the tumor was wearing me down. Since surgery, I feel lighter. I've had zero pain. It has been far easier than I expected. Look at that. Whole new face. Not used to not having hair. Kind of feel a little naked. It's been basically 20, 25 years since I shaved last. Back in the 80s and 90s, how I used to go around for a while. Feels fantastic.
Today is Charmaine's surgery, and our goal today is really to try to improve the function of her head and neck region. She's got tumors that are blocking her nose, they're obscuring her line of sight, and they're starting to actually intrude upon the way she eats. So we're gonna try to clear those areas up. What's going on?
I'm fine. I'm okay. Anxious for today.
Yeah, you look beautiful. You got your hair braided and everything.
Not all, but yeah, halfway.
Yeah, okay. I'm a little bit worried that I can't find this vein on Charmaine. So I'm gonna bring in my anesthetist, Lori, and see if she can give us some help.
Hello, it's Lori.
Hi, how are you?
Sweetheart, it's good to meet you.
Same here.
We may be able to get an anticubal.
Yeah?
My plan is to place Charmaine under general anesthesia. To do that safely, we have to be able to properly fit a mask over her face and gain IV access. So first, we need to find at least one part of Charmaine's body that isn't covered in tumors, but gives us access to a vein.
I don't feel anything.
No, it looks blown anyway.
Not even see, it's just, I can't even feel. Let's see what we got on this other arm.
Feel anything?
This is no way. There's nothing here that's usable. That thumb isn't usable. This finger, these aren't usable.
The tumors are obstructing all the normal places where we would go to find an open vein. If we don't get that IV in her, there will be no surgery, and then she's going home.
Okay, now this, see, look at that, Tim. I got a hand that I think is worth looking at.
Breathe. Breathe. You can squeeze me. If you're feeling pain, you can squeeze me.
One thread. I could not pass the tumor.
I'm inclined to give her some local. I'm gonna try to remove some of those tumors under local anesthesia to clear the area where we would normally expect to find veins. Then hopefully we can get an IV into Charmaine, get her properly fitted with a face mask, and put Charmaine under general anesthesia as we intended to do.
Before we go in, I want to see that mask on her face.
Also, because she has all these tumors, they might make it impossible to really push the mask up against the skin.
I got a 26
I'd take these
airway.
off under local. I could clear this part of her nose.
Okay.
Yay, here we go.
All right, let's get this party started. We're gonna take a few of these off. You're gonna be awake, but you won't feel any pain, okay? We're injecting Charmaine with a local anesthetic so that we can numb her skin. Boom! So we'll start with this one. And our goal right now is just to clear some of the large masses as quickly as we can so we can get a mask on her.
Are you all removing some of the bumps?
Yeah.
Some of these larger tumors are blocking her vision, so it's sort of a dual benefit.
That's a vein. There's not even a doubt there. I could get that one.
Did you find one?
Yep.
Oh, that's awesome. That IV is huge, but what we noticed is while we were working, she did very well under local anesthesia. And so the plan is going to be at this point to do as much as we can under local. And if we get to a point where we're using too much, we have the ability to convert to general anesthesia. That's a huge win for us. This one is going to be gratifying to get rid of, because I know this is going to make a difference. She's for sure going to see better, so that will be helpful for her. But we still have a lot more ground to cover, so we'll keep working.
Awesome.
But I sort of feel awesome.
You feel awesome. It's because I'm giving you good drugs.
It's time for Frank. Frankie, it's time for him to go. Charmaine's got a tumor that she's named Frank that bounces in and out of her mouth whenever she speaks, so she could bite that, which could be extremely painful. So Frank had to go. Bye-bye, Frank.
See it?
Wow. He was huge.
She's gonna breathe much better. She's gonna talk better. She's gonna feel a lot better after today. Charmaine,
Yes.
you didn't tell us you were so pretty.
I didn't know I was so pretty.
You didn't know. Come on.
When Dr. Osborne said that he would help, I was so happy. Dr. Osborne was able to remove more bumps than I was expecting. So it feels nice. It definitely does feel nice. Life is 100% better for me. I love the way that I look now. I get the majority of the bumps off of my face. Before, it used to be a lot harder to put on makeup, like the powder and stuff, but now it's not so hard. Before, I couldn't see anything at all, like my face. But now you could naturally see my eyes, you could see my nose, you could see my mouth. I could see properly, and most important, I could breathe much better. I feel beautiful. I really do. I really do feel beautiful now. I fit better into my clothes now. Even if I put on a dress or I put on a skirt, I could see the difference. I was shocked when I noticed this tumor from my leg was gone. Shocked and happy at the same time.